Hair loss is not just a man thing. The fact is, by the time women reach their 50s, close to half will have some form of visible hair loss. But there are lots of things they can do about that. Joining me now is hair loss specialist Dr. Robert Jones. It's good to have you here, Doctor. Let's deal first with the causes of hair loss.
Okay, Marcy, I'm really happy to be here. I think this is a very important topic. It affects a huge portion of my practice these days as females. The most common causes of hair loss in females are, one is just age and just female pattern baldness. As women age, they tend to get thinner, their hair gets thinner, and they tend to thin out, and usually, again, by the time they hit their 50s, about 50% of females have some thinning, a visible thinning of their hair. There's a number of other causes, usually, medications at an earlier age, or pregnancy, and also many chronic diseases like hypothyroidism, autoimmune diseases. There's a lot of different diseases that can cause hair loss as well.
And so what can you do? If this happens to you, what can you do about it?
Well, surprisingly, I mean, a lot of women that I see have been to see their doctor, and they're basically brushed off because they don't have a medical problem. And a physician usually sees it as something that they should just deal with. But I'd say probably 70 or 80% of the women that come through the door, there is something we can do. And basically, I put treatments into three categories. The first is medical treatment, and for women, the most common medical treatment that we give is usually minoxidil or Rogaine, and that can usually increase the density of their hair by about 20 or 30%. The second is cosmetic options, the most common being cosmetic hair fibers. And there's a number of different fibers out there, just like makeup, that can make women's hair look thicker, and it definitely works. And I'm amazed at how happy women are when they realize that there's some sort of makeup or cover-up. There's also sort of wigs and that sort of thing if the hair loss is quite severe. The last option that we offer patients, and it's usually as a last resort, and I'd say less than 10% of women that come through the door are even offered this option, are hair transplants. And what we do with hair transplants is take hair, if they have a good donor site, more hair in the back and less on top. What we can do is take the hair from the back and plant it on the top. So those are probably the three main categories of treatments that we can offer women.
Now, how do you know when hair loss isn't normal and there is a problem? Are there signs that people should look out for?
Well, I think basically the first thing any female should do is consult a physician that's familiar with hair loss. I'd say probably at least 30 or 40% of females have some underlying medical problem that can be dealt with to help with the hair loss. So it's although female pattern baldness is common, it's medical causes and drug causes and that sort of thing are far more common in females than males. And when we do find a cause, fortunately, we can treat it.
Thanks so much.
Well, nice to be here.
Good to have you here.
Thanks, Marcy.
And now a look at this season's top wedding trends.